once again, Dr. Z. We have another Dr. Z, don't we? Tell us all about her, and then she can tell us all about her.
Yes. So this is Dr. Miriam Zylberglait. I'm sure I'm gonna mess up your last name.
Don't worry, you are not the first one and you are not the last one, so I don't take it personal.
Dr. Miriam, she's a doctor, she's a mother, she's an author, she's a speaker, she's a podcaster, right? She's a coach. So just introduce yourself to our listeners and kind of tell us stuff about your background and then your journey, what led you to what you're doing right now.
Thank you so much for having me. And it's the first time that I meet another Dr. C, so this is really a pleasure.
Wow.
And so I am Peruvian. I am a Latin girl. I grew up in Peru, went to medical school there, and worked for 10 years as a physician in the Navy. I came to the US 12 years ago following the love of my life. So I came from for vacations. He proposed. I quit my job via Skype, and I started from zero again in this country.
Wow.
Yes, on my almost 40s. During the process of getting my licensing and my training here as a physician, I got pregnant. So I was running in the hospital during 30-hour calls with a big belly. So if you have any question about how much I love medicine, I believe that that is obvious. And I was able to fulfill my dream to become a doctor here. I have three specialties: internal medicine, geriatrics, and obesity medicine. But my real interest, using all that knowledge, is really is focused on well-being, mental and physical, emotional well-being. That is really the reason why I wrote a book about well-being, and why I opened my own clinic to offer this comprehensive, holistic, one-to-one and personalized type of care that I believe that is what really helps patients.
Yeah.
Oh, okay. Well, I was just going to ask. So you have a specialty in geriatrics, and as far as, do you just incorporate the wellness into a patient visit, or do you also have more the wellness on the side that's not particularly traditional medical type care?
So before you answer that, for people like me, the layman, geriatrics, you doctors in this doctor speak you got going on here, dumb it down for people like me and give us an idea exactly what you're doing with geriatrics, so we can kind of get a paint that picture of it, and then
So I try to explain geriatrics in the same way that people recognize pediatrics, right? Pediatrics is for the kids until you are 18 or 21, depending, right?
yeah,
And geriatrics is 65 and above. And in general, it's the same approach, right, that we do in internal medicine, that is to treat patients, in a comprehensive way, do prevention and manage medical conditions. And your question, I appreciate your question. It's a very smart question, actually, because yes, we have this idea that doctors, we treat diseases, and in many cases that's what's happening, especially right now when we have 15 minutes appointments. It's very hard to to do more than that. Because of my training in geriatrics and my training before in Peru, I was educated with the idea that human beings are patients, patients are human beings, and you are not livers or kidneys or bones or results of laboratory. So you cannot have good health without well-being, vice versa, and you cannot treat diseases if you don't take in consideration cultural background, social stories, emotional, even financial aspects of the life of someone. So for me, this has been attached all my life. has been connected. And that's probably why I have been struggling so much during the last few years when I was restricted to such a short time with my patients, that I was not able to provide the type of care that makes me proud and that makes me a good doctor, or what I define as a good doctor.
Yeah.
So what I did when I left the system and I opened my practice, I decided to just focus on the gaps that I see on the healthcare. So instead of doing the role of a primary care physician, which I don't want to replace, I believe they have their value. I was there before, but I
Yeah.
want to focus is on those areas that they don't have the time to take care of: obesity, mental health, cardiovascular prevention, well-being in general. So that's what I am doing right now. But they are connected. It's impossible to separate them.
Right, right, right.
Yeah. So it sounds like it was squeezing your spirit to a certain degree. And I love what you're doing, because I think what's happened in the world, not only in this country, but more likely throughout the whole world, that it's turned into this, okay, like you said, you got 15 minutes. Tell me real quickly, and blah, 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 you know, and they're not even looking at you. They're on the computer, blah blah blah, the
Yeah.
doctor, and you know, it's just so sad. That I love what you're doing. Tell us more about how you kicked off this business, how you came up with this vision of. I love that, because I'm working with a doctor right now because I have mold toxicity, and I love that what you're doing sounds like a lot of it is preventative stuff, which has really been squeezed out of the culture of medicine,
And then,
correct?
yeah, and if I could just ask, like, are you also managing, like, if somebody comes to you for well-being, are you also managing their medications, doing their blood pressure, checking their, their blood sugars? You're incorporating that into their visit to you?
Yes, so all my visits are virtual because that allows me to reach out. In this case, I'm working right now only in Florida. I'm planning to expand.
Mm.
This is for legislation from the country. You can only, as a physician, work where you have your license. So I am working on that. But Florida is so big. So being a virtual physician allows me to reach out to more people and help more people. But I use a technology that allows me to continue being the type of doctor. I didn't stop being a doctor. I continue being a doctor. I added more things. And what I
Right.
am doing is using remote monitoring, sending devices to the houses of the patient so I can have the vitals or their weight, fat percentage, and anything that I consider is important for me to follow. I
Hmm.
add the patient in the combination, so he is part of the team, and that creates accountability, right? At the end is the health of the patient. The patient is an adult, and they are as responsible of their health or even more than the doctor. They need to be part of the team. They are the most important part of the team.
Absolutely.
So I am doing also regular blood tests and etc. So all checking the medication. So all that part of medicine has been there, continue being there. A few things that I added that I normally was not allowed to do it because of the restriction of the system, because insurance will not cover, because we don't have the time, and etc. Is I'm working with someone that is a mindfulness coach that is helping me to help my patients if they have insomnia, stress, anxiety, depression, if they eat too much or not too much because they are stressed. There's no point for me to give them vitamins or give them injections or try to treat the signs of their emotional problems. I need
Right.
to help them to cope. So while I may prescribe something at the short term, but I am working in a way that they will learn how to cope long term, and they will not need these medications long term. I'm
Mm.
Right.
also using DNA testing to be able to understand certain characteristics of the bodies that allow us to take decisions in a better way. So we are really reducing the time and the effort until we get a solution. We can be a little more target oriented in the way that we take decisions. And this
Right.
even help us with medication. We have already tests for DNA that allow us to select medications that will have better results for patients with mental diseases. So there is no reason to try 20 pills until you get there, when you have at least, maybe you will have five to select from if you use this technology. Last but not least, I'm doing precision medicine. Precision medicine allows you to create a specific supplements from vitamins or probiotics based on the characteristics of your body. And this could be, you do a nutritional assessment, right, based on your blood or your urine, and you really identify what you are missing. And instead of going and randomly picking a multivitamin that you have no idea even if will help you, and introducing your
Yeah.
body a lot of chemicals that you, by the way, don't need. So I
Yeah.
can create, you need A, I will give you A. You don't need B, I will not give you B. The same with probiotics. That is, again, a serious problem, because even in my case, I go to buy a probiotic and I have like 20 options and I have no clue which one do I need. So right now there's the technology to recognize what type of flora you have, what type of flora you are missing, and to
Yeah.
prepare these capsules or powders for you, which again reduce polypharmacy, reduce this extra chemicals in your body, and help you to be more efficient in your treatment.
Yeah,
Mm.
see, our self-care 101 master class, What Matters to You, is, if people track us down after seeing this, they're going to see that it's a wonderful add-on to what you're doing, because what you're describing here is what medicine has gotten away from many years ago. I remember when I was a kid, you go to the doctor and they'd say, now make sure you do this, this, and this. They don't have time to do that anymore. And that's where
No
we
more.
come in with our group, our Self-Care Secrets Facebook group that I'm glad you joined. And we're, like we said, we're so excited. We talked a little bit off camera about how we're going to expand that. And that's really what people need, is once they come see you, they also need to, like you said, with the mindfulness coach, they need to develop a team. We all need, it's a team sport these days,
Yeah.
right? Because I say this, it sounds kind of goofy, but we're under attack. We don't even realize it, because it's like the frog in the kettle that's being slowly cooked, right? There's all this stuff. We're pummeled with ads on TV and all this carb stuff, and people are, gee, why am I so overweight? Why am I this? Why am I that? And because they think that the government, because they allow this, it's okay. It's not okay. It's
Yeah.
it's killing you.
And how much
Yeah,
is
but we
really
need to understand that not everything is bad for everyone. Not everything is right for everyone. That against against our uniqueness, right? Our genetic background, our culture. There are so many things that influence how we react to the stimulus that we receive, right? And this could be the food that we take, the physical activities that we do or not, the type of job or the type of stress. So we need to understand that we need to be empowered, that knowledge is power, right? And that we have a responsibility with our own body. And we have a responsibility also with those that we take care of, right? Our kids, our parents, the family that love us. If we have co-workers or employees, we have a responsibility with the society, and we need to be in good shape in order to be able to help others. So I don't like to say things are one extreme or the other, because really depends on your own characteristics. But you need to be responsible to understand and learn what are your characteristics and what is good for you and what is not good for you.
The point is, and the reason I'm saying this is because I know a person who is in great shape, has a construction company, he's active, he's busy doing stuff all the time, but he's pouring down Mountain Dews and all this stuff. All of a sudden, guess what? He's type 1 diabetic.
Yeah.
That
Yeah.
should never happen. But because of what's available out there and what he's consuming, I'm like, well, what are you eating? Because I'm type 1 diabetic because of my situation. So That's why I love what we're doing, because Dr. Z is a doctor. I have all this expertise in experience of having gone through it, and the combination of it can really be helpful to people as it with what you're doing.
Yeah,
and
and I
and,
would.
and the situation with type 1 diabetes is very different than the type 2 diabetes, right? And I will be careful without having the complete information to have a formal opinion, right? But type 1 diabetes is developed because of genetic reasons or because of a severe, the equivalent to a type 1 diabetes will be generated because of severe damage in the pancreas, where the pancreas will not be able to produce insulin. It's very different than the type 2 diabetes, where yes, our habits, our type of diet or our weight will be the reason, or will be pushing us to that situation, right? Type 1 diabetes is really a damage, a severe damage of the type of insulin that we are producing, or the amount of insulin that we are producing. And this does not necessarily, I will say, this does not correlate in general with the type of lifestyle, right, or his weight, or etc. So I will be very careful. It could be even an autoimmune condition. So I will be very careful to describe more than that, because probably there is more information that we don't have available right now to have
I did,
a proper clinical opinion.
it is interesting though, because I've been doing this presentation on diabetes because I'm a medical examiner. And so I always present it. We talk about how you can die from, diabetic coma, but yet I think people don't really register that. And so in my presentation, I have two men in their 40s who both died. One was a type 2 diabetic, and so he was on metformin, 1,000 milligrams twice a day, and he died from a diabetic complications. And the other one was undiagnosed type 1 diabetic, also in
Mhm.
his 40s. Quote, healthy guy, hiked every day. But it was interesting because at the scenes at both of their houses, tons and tons of cans of Mountain Dew.
Yeah.
So it's funny that you mentioned the Mountain Dew, because obviously one of the symptoms of diabetes is increased thirst. And so they
Increase
were
thirst.
both drinking Mountain Dew, which is like the worst thing that they could be drinking at the time, because it's just pure sugar. So they already have too much sugar in their blood, and they're drinking even more sugar. So there is so much lack of awareness. Like, I
Lack
thought
of
with all the
knowledge,
information
yes.
out there that people still are drinking so much Mountain Dew.
Yeah. It's
Yeah, and
crazy.
again, that could be perfectly fine. Maybe pushing a little to drink certain things, or to eat certain things that have high quantities of sugar or carbs in general, right? Because not everything that is bad for diabetic is sweet, right? We know that any carbs, so even a pizza, pasta, bread, a potato could be a problem, right?
Well, I have to say now, the pizza and the cake mixes and the sauces, they all have the
Right.
high fructose corn syrup. So
Yeah.
that's in
So
almost every processed food. Yeah. It's
So,
hard to get
so,
away from it.
so, yeah, we need to. I agree with the fact that we need to be able to educate the community,
Yeah.
and that requires from doctors or any healthcare professional extra time uh, to do that. Because yes, for sure, if your preventive visit, your annual visits last for less than 15 minutes, you don't have
Mm.
any type of education, you are lucky enough to have normal labs this time, right? But normal labs do not necessarily prevent you to have other conditions in the next year, right? Because we now you are waiting for the next year. Things may happen. That's number one. And the second is our body is resilient when we are younger, but then we enter in certain ages where adapting to what we are eating or our lifestyles that were great when we were 20s, you will not keep your weight and you will not keep your levels of sugar or cholesterol
Or
anymore
so.
20 years later with the same lifestyle, right? So again, it's a lot of prevention. We are not in a culture of prevention. I
Right.
want to say I don't blame the doctors because I will be very unfair to blame doctors, nurses, or any other healthcare professional. This is not their fault. And I repeat this again and again because they are not the ones that decide how many minutes you spend in the room with them. This is done by managers that have zero education in healthcare and that receive bonuses for the amount of visits that the doctor runs that day. The
Absolutely.
doctor does not receive those bonuses. This extra money goes to the to the pocket of the manager that is pushing and pushing for more appointments and is affecting the quality of treatment that patients receive. And I repeat this and I say it loud for two reasons. Number one, because there is a misconception of who is responsible of those things, and some patients, majority of them, they will blame the doctor. He doesn't care or she doesn't care about me or the nurse. That's not the case. The second reason is that patients have the right to advocate for themselves, right? And
Yeah.
to say, you know what, 15 minutes are not enough. I have a long list of problems and I'm coming here and I am paying here for to solve my problem. I will not be kicked out 15 minutes later. I have more questions, right? That's the right of a patient to
Yeah.
solve the problem when they go to visit a doctor. And they need to enforce that. And on the other side, I want to advocate for nurses, doctors, and other healthcare professionals that are being really pushed against the walls, right? And that are suffering tremendously. And if we go back to just data, we will see that 65% of doctors, and the numbers for nurses are very similar, are suffering from burnout, 60% are suffering from depression, and 800 nurses die by suicide every year, and 400 doctors die by suicide every year in this
Wow.
country. And these numbers are not COVID related, because that was the kind of like, oh, this started with COVID. No, this not started with COVID. Got a little worse with COVID, but it was already unacceptable. So again, the importance of patients to be empowered, to be
Mhm.
responsible of their own health, to advocate for themselves, because sadly, your doctors, your nurses, in many cases have their hands tied and are struggling as much as you as a patient.
Yeah, yeah.
Speaking of struggles, give us an idea for somebody, excuse me, in a position like yourself that is decided to strike out. What are some of the early struggles, one, maybe just one, that you can share with us for somebody that may be listening that wants to, strike,
Try to
do what you're
escape the
doing?
system.
Yeah.
The system will follow you. You try to escape the system, but the system follows you and run after you, and still you have to uh, try to keep some independence from insurances and from pharmaceuticals and other entities in order to be able to really provide the care that you want. That's one uh, concern. The second concern comes again with the lack of education of patients, right, and the lack of awareness. They believe, and I agree with them, right, that healthcare should be a right, and the quality of care that you receive should be like A, right, top. That's not reality. So they will say, no, I will not pay a concierge doctor or a private doctor to receive what I can receive or I should be receiving through my insurance. And I understand why, right? Because in theory, you should be receiving the best care with your insurance. Sadly, that is not necessarily the case, not the reality for many. Depending on your insurance, depending on the practice that you visit, etc., depending on your own medical condition. So, try to explain a patient that his or her care are important, and if they can go to a spa and get a massage or cut their hair or buy this beautiful car or getting a cruise is as important as investing out of pocket care, because in their specific case this could be the difference of life or death or quality of life or disability or 10 more years of wellness. That's a very complex situation, again, because they don't understand how difficult it is to navigate the healthcare system today.
Well, so how are your what is your fee structures? How is that set up? Because you do accept insurance, but then you also have kind of the concierge.
So no, I do not accept insurance. However, I do everything under the regulations of the insurance in a way that patients can go back and request the reimbursement. I don't do buy insurance because at that point I will not be able to provide my patients with the things that they need. They will not. You cannot order this because it's not covered by the insurance. You cannot order that. You need to follow this protocol. For example, you will see many times that we know that this medication will not work with this patient. They need this medication, but this medication is tier 3. So you need to try the one, you need to fail with that. Then you need to try now the number 2. You need to fail with that one. And now they allow you, the insurance allows you to provide what you were trying to start with at the beginning, which
Yeah.
is ridiculous. Same with tests. You need an MRI, yeah, but we will not pay for the MRI. You need to do an X-ray, and when the X-ray is normal, which we know that will be, you can get the CT, and then when the CT is normal, we know that the CT will be normal because doesn't test what we want to test. So now you can order the MRI. That means that 7 months later, you finally get the test that your patient needs. Nutritionist, you cannot send a patient in majority of the insurance to a nutritionist if they are obese. They need to be diabetic to be covered. So
What?
so I have been celebrating diagnosis of diabetes because now insurance will pay for the treatment of a nutritionist. And if you think about that, that really is delaying the care of patients, and is for a physician is traumatic. It's like you spend hours on the phone trying to convince someone on the other side that you don't need that test, that you need another, right? So I decided, for the wellness of my patients and for transparency purposes, that I will create all the super bills and provide that to the patient so they can receive the reimbursement. And I hope the insurance will be fair enough to do that
Mhm.
appropriately. But if they need and want appropriate timing care, I need to have my hands untied. And it's very, again, it's very challenging, right? Because I have been working for the system all my life, so I need to also adjust to this. I would like to make things easier for my patients, but I feel like I need to be fair with them, transparent with them, and I need to be aligned with my values as a doctor, and offer high quality of care.
Mm.
Do you offer like a monthly? Is it like a membership or?
Yes.
Okay.
Yes. So yes, I offer even packages that could be 4 months, 8 months, 12 months, depending of the patient, with the ability of extending them. I just get a percentage initially to cover for the tests or devices that I will be sending, right? So I can purchase those things and send them to their houses. Everything is done in the house. They don't need to go to the laboratory. The tests are covered under this umbrella. The probiotics, the vitamin supplements are covered by this umbrella. Nutritionists, nutritional plans, even the therapy with the coach, the health coach, or the mindfulness coach are covered. So everything that the insurance may not like to cover is already covered under the umbrella of this kind of subscription, as you mentioned. And those things that the insurance will cover, they will be prescribed in the way that the insurance will cover, so they will not be affected by working with me, because I continue having my license. I act as an MD, and I use the ICD 11 codes and etc. To make sure that I am advocating and protecting the pockets of my patients as much as possible. But the things that are not covered are not because I am not willing to cover, it's because the insurance is not willing to cover. That's the
Right.
reality, and I make it very, very evident for them, right? So they
Mhm.
know. I believe the patient needs to know what is happening and why their care is being compromised at such a level, right? That you need to celebrate a medical condition as diabetes, that we know that it's not an easy disease to manage and to live with, because if not, they don't have the right to receive certain medication and certain management. Unfair
Yeah.
on so many levels.
So let's talk some about how, when you decided that's it, I'm going out on my own, how has your business changed from, once again, we like to provide things for people that are considering becoming an entrepreneur or running a business, things of this nature. So tell us more about how your business has changed from when you first struck out on your own to where you are today.
So I would say that, thank God, I didn't have to do many changes at this point,
Mhm.
because I was able to plan ahead of time and create a team of cheerleaders and supporters and coaches, formal and informally, that were guiding me through the process. This is a very difficult, challenging process. I will not lie. I didn't know that this will be so challenging. I
Mhm.
several layers of legality that need to be taken care, especially when you're talking about an MD, and probably this applies also to a nurse practitioner. Because of our liability level, we being licensed, we have to be very careful to work with lawyers. We need to understand the system, we need to understand the aspects of marketing and HIPAA. There are so many things that we need to understand. So this is something that nobody should be doing by themselves. This is something that is really you put in your ideas as a physician of what you want to create in a clinical manner, but having those experts supporting and helping you to transform these clinical dreams in a business reality, because these are two different animals, very different. And majority of doctors, we were not trained in business. I just recently got a grant to train as a woman entrepreneur in Cornell, and I was feeling so ignorant, right? That I was like, I was like, oh my god, what are they talking about? So it's absolutely a different set of skills and a different set of knowledge. So I will never suggest someone to jump into this specific pool by themselves. There's a lot of risk of legal issues, and losing money, right, and going against the walls, and failing in a important way if you don't do it right.
It takes a village. It sounds like we don't, people, if you're considering these types of things, first off, it takes a village. You have to get in the village and get people around you, create that network, which it sounds like you've done. You've
Yeah,
created the network, and you need to build a team, right?
Yeah, yeah, it sounds like that.
absolutely. And you need
Did
to
you
put your
ever?
ego on the side, right? Like your ego, as I know a lot as a doctor, yes, great for you. You will keep being a doctor, but that doesn't make you a business person. You need to
Right.
really open your mind, and acknowledge that that's something that you don't know, and that you are ready to learn from others, and that is okay, absolutely okay. This is not a question of ego. This is not a competition. You want to be successful because you have a mission, and your mission is to help others in the best way.
Exactly.
So it sounds like you said there was quite a lot that you didn't know or even anticipate. Did you ever have a thought like, I'm just gonna go back to just being a regular doctor?
I had seconds, and actually my husband has been the one that every time that he sees me that I am entering in a tantrum, he will be, before I even get there, it's like, well, if you want to go back, and I will, with that sentence, I know that I need to stop whatever I am doing, and I need to collect myself again, right? No, I seriously, um I don't want to go back
Yeah.
to work in conditions where I am not aligned with my values. That was very painful for me. uh, and I don't want, I don't see failure in general. I don't like to see failure as an option. The worst scenario for me is this will not work as fast as I want, or it will not be as easy as I wanted. uh, but if plan A doesn't work, I will get B and C and D, and I will keep going, because again, and I feel like this is something that, if I will have to share something that I learned from this experience, is that if you have a purpose or a mission, right? Everything that happens in the journey towards your mission is something that you will be in some way able to tolerate,
Yeah.
because at the end you know exactly why are you doing it. You
Yeah.
understand why are you going through this, and you keep your mission. When you start and you have a goal that is not aligned with your values, that is just random, superficial, I mean, it's very, very easy to quit, right? But
Yeah.
when it's, inside of your heart, and it's part of something that is really important for you or for those that you love, quitting, at least for me, is not an option.
And do you have any models, any role models? Because you're really creating something that doesn't really exist. So are you creating it as you go, or do you have a general vision? Or do you work with mentors or have someone who has done similar that is kind of mentoring or helping you along the way?
Yeah, let me, if I can add on to that. I was thinking it as you were talking about how your husband is involved, and he sounds like he's your rock, right? It sounds like you're
Yes, he
gonna have
is.
he I wonder how many times he's had to talk her off the ledge. So to add on what Zelda's, to enhance the question, who's that number one person that you really is your rock, that is really giving you the inspiration when times are tough, to help you to keep going, and give us a maybe a story about how that has helped you.
I will tell you, and you will probably be expecting something a little different. But my rocks, and of course my dad and my husband, they are no doubt about that, and many of my amazing friends. But my rocks are my kids.
Oh,
Oh,
nice.
Uh, I will tell you a couple stories, and probably one of them. This was one of the last drops. I was already working on telehealth, not for me, but for someone else, a company, and
Mm.
very unhappy with the process. And that day, I was at home, and a patient was super upset because the insurance didn't approve one of the the
Yeah.
orders that another doctor or nurse asked for him. This is the first time that I am seeing this patient in my life, and
Mm.
lucky me, he decided to insult me,
Oh,
and express all his hate against the healthcare system directly to me.
yeah.
He was very expressive, and he didn't limit himself on the selection of words. I didn't notice that my boy, 7 year old, was in the room at that point,
Mm.
and
Okay.
he heard all these insults and bad words, and he
Wow.
started crying and came to me. It's like, why he's insulting you? You are a doctor, you are trying to help him.
Yeah.
And the guy heard that, and he just hung up on me. And I asked myself, is this the type of example that I want to set for my kids?
Yeah.
Is this how I show them that you need to be respected, that you need to be in a job that you feel is fulfilling and that makes you feel proud of yourself? How I will say that to my kids after that conversation?
Mm.
Yeah, and unfortunately, you ran into a situation which we see quite often,
Yeah.
misdirected anger. You happen to be that person who was in the way,
Yeah.
right? And when we can recognize that, that's why awareness, as we get older, we gain all this wisdom. We start to go, grocery store the other day, the cashier's like, yeah, this guy laid into me. I'm like, look, you were just, unfortunately, you were in his path. He couldn't take his anger out on the person that he wanted to, so he
Yeah.
picked you. Wow, time is winding
Time
down
is
here.
really
Holy cow.
winding down. I know.
Dr. Zelda Z, Dr. Z, any
Yeah.
final question?
Yeah. Well, thank you so much. I do appreciate this. This has been great. And yeah, just I was wondering about your future. Like as you learn everything, are you documenting it so that you can teach other people? Because
Right.
this
That's a
model
good
is very
question.
powerful. Yeah.
Let me tell you my dream. And well, dreaming is so not expensive, right? So who
Yeah.
knows what will happen with this? This specific dream. To be sincere, my dream is not to become a millionaire with this new adventure. My
Mm,
dream is to grow enough to be able to provide opportunities of work to other doctors like me
yeah.
that are mothers, immigrants maybe, that are trying to find a job where they feel respected, where they can accomplish their role as mothers, as wives, as physicians, being proud of themselves and without compromising their well-being. So I hope one day I will have, I don't know, a few dozens at least of doctors working with me, and feeling that something good happened in their lives, and that this journey, my journey, really is helping not only patients, but it's only also helping other healthcare workers.
Yeah. It's
Yeah, be that
beautiful.
catalyst. Be that catalyst.
Yeah.
I love that. Be the change, right?
Hmm.
Real popular on Facebook. Click on it, blah blah blah. But be that catalyst for to get the healthcare system back to where it probably was many years ago.
Yeah.
To
Yeah.
re engineer the culture back to where it was.
And making it a win-win for the patients as well as for the caregivers.
Exactly. So,
We
with
all
that
need it.
said,
We are all humans, right? But people need to understand, and that when we are using the white coat and we look like maybe superheroes, we are still
right,
humans. We are
exactly,
still
exactly.
having problems, having sickness, and we are also patients, right?
Yeah.
Uh, so we need the same empathy and respect that our patients deserve. And right now, patients and healthcare workers need to be together
Yeah.
for first time, really, right? I will not say it against the system, but on favor of the well-being of each of us in the community.
Nice. That's a
Absolutely.
great place to wind it down. So, where can people get a hold of you? We'll put your links and connections in the
Show notes.
show notes,
Yeah.
but just go ahead and tell us live here. What's the easiest way for people to get in touch with you?
So I am at LinkedIn. That's the best way to connect with me.
Okay.
And as Dr. C, and you can you will be sharing the link. My website is www.virtualwellbeingmd.com. You can get an appointment with me through that website if you are in Florida. And in the next few months, probably I will be open also to Texas. So
Sounds
Texas is
good.
coming.
All right. Our appointment is over. And as always, thank you in advance.
Thank you, guys.
Just thinking and growing and learning and knowing and thinking and growing and learning and knowing. Yeah. Just thinking and growing and learning and knowing and thinking and growing and learning and knowing. Yeah. Yeah, we're thinking and growing and learning and knowing and thinking and growing and learning and knowing. Yeah. We're thinking and growing and learning and knowing and thinking and growing and learning and knowing. Yeah. We're thinking